And just so everyone knows, we will be recording the whole session, and we'll make that available to people as we go. Okay, so thank you everyone for joining in to this our conference. This is a seminar conference or seminar panel sponsored by the Office of Practice and Research. It is part of our work that we're doing, which is a collaboration between faculty, staff, and students. For this seminar series this semester, we're entitled Public Health in Action. So for everyone who is interested in more about this, you can go to our site and find out what we do and what's going on. So without further ado then, let me introduce. So we have our panel for today. Our moderator will once again be Ms. Jamie Cromley. We thank you in advance for that. We have two outstanding students who will be speaking today regarding their experiences. The first student is Ms. Karabi Barai. And I'm hoping I'm pronouncing both of your names correctly. And then we have Ms. Sonam Sherpa. And I will let them do their brief bios for you. But I'll let Ms. Cromley take over for now, and then I'll be coming back close to the end of the session. So Ms. Cromley, take it away, please.
Thank you, Dr. Telfair. We have two great students here with us today. I'm excited for our discussion. Karabi, could you take a minute and just introduce yourself to our viewers today?
Hi everyone, my name is Karabi Barai and my major is Community Health Behavior and Education. I'm doing my JPH and I'm the first year student. Right now I'm doing a contact tracing job with Southeast Health Department. And I'm really grateful to Dr. Telfair and everyone who is giving us that opportunity to share our story with everyone. Thanks.
Thank you. We're glad to have you today. Sonam, can you take a minute and just share a little bit about yourself?
Yeah, sure. Hi, everyone. My name is Sonam Sherpa, and I'm originally from Nepal. So I am a community health and education concentration, and I will be graduating in this fall 2020. And yeah, I started this contract tracing as an internship from May, and I'm still continuing with it until December, and hopefully continue doing it. And yeah, so I'm happy to have this opportunity to share our experience with you guys.
Thank you. We're very glad to have both of you today. So let me first just start out and you know, what we're going to do is I'm going to be asking the two of y'all questions, okay? And we'll go back and forth. We'll save the last 20 minutes or so for the viewers to ask questions. So if you're watching with us today and joining with us, if you can use the chat box for your questions, or you're welcome to unmute yourself and ask. So I will open it up for questions closer to the end today. So first, Karabi, let me start with you. Can you tell us a little bit more about how you heard about this opportunity as a contact tracer with the Department of Public Health and what drew you to this opportunity?
I was looking for an opportunity where I can work directly with a COVID-19 team. I got an email from our Jiann-Ping Public Health Department. When I applied for this job, it was a volunteer opportunity. I knew there are shortages of contact tracers and they were desperately looking for public health workers. I was willing to help the community and do my part. It was an excellent opportunity to be the part of that of a COVID-19 team and learn what they are doing to handle the pandemic. I would like to give thanks to our department for collaborating with Department of Public Health and give us that excellent opportunity to be the part of that history.
It really sounds like a great opportunity. So now, what drew you to this experience of a contact tracer? She might be frozen.
Frozen, yeah.
Okay, we'll let her rejoin us. Maybe she's having some technical difficulties. While we're waiting, Karabi, I'm going to go ahead.
I think she's back. I think she's back.
Yay. Okay. Hey, Sonam.
Okay.
Welcome.
Hi.
Can you share a little bit? I think we lost you for a minute. Can you share a little bit about what drew you to this experience as a contact tracer?
Sure. So I was looking for an internship like since spring, in the beginning of spring. And then all the internship that I applied for, it all got canceled because of COVID-19. And so I was just looking for a last minute internship. Like I'm just going to like take whatever I get. So, and as soon as I got this email from Dr. Nazaruk about this opportunity, at that time it was unpaid and it just says looking for contract tracing. So I just emailed her saying I'm interested for this. And so I just emailed her, and then later on she connected us and everything, and it all worked out very well. And yeah, and later on it also turned out to be paid, so that was even better. And yeah, so that's how I get into this internship. It wasn't like a hassle, or we didn't went around looking for it. It just came into us, basically, the opportunity.
Thank you for sharing. Yes, I know several internships were affected back in March and April, and this door opened up and the department notified our students about it. So very thankful for that partnership with the Georgia Department of Public Health. Karabi, can you tell us a little bit about what the recruitment and training process looked like for you personally?
For my case, the recruitment process was kind of different than others. At first, I applied for the job, and we need to go through vigorous procedure of verification. In my case, because I'm an international student, I need to take CPT, curriculum practicum training. I would like to thank International Student Office and Dr. Nazaruk to help me through the whole procedure. Then we went into a vigorous training process in Department of Public Health. We primarily learn about MTX. MTX is the system by which we keep track of all the data and work on COVID-19 patients. We have specific script, what we follow for the communication. We need to keep track about updated Department of Public Health contact tracing manual. It changes day by day according to the need of community. And we need to keep track DPH new releases, Southeast Health Department community resources, and so on. So it's a vigorous training process and hiring process.
Thank you. So how did the training process look like for you? How did Georgia Department of Public Health prepare you to be a contact tracer?
Yeah, for us, I'm same with me. I'm also international student. So just to get, since it's a paid internship, so for us to get like legally work. So since it's a paid internship, so for us to get paid legally like work, being able to get the work authorization, so we had to go through this process like Karabi described, getting a CPT to get for work authorizations, all this. But the training process in general was very simple and very yeah, it was easy to follow, and almost they gave us a week. So we had to watch a video that was a contract tracing video that was made by the Johns Hopkins, which was very helpful. And we also had to learn about HIPAA procedures and some things that we have learned before. So it was nice to refresh it again. And we also had to learn like how to work from home, like remotely, since none of us has worked that before. So there were a lot of like trainings that were very useful, I found it. And yeah, and it was very easy, and the communications were fast. So yeah, everything was simple, and it was, I think we were prepared, like we were, yeah, they prepared us well for the job.
That's great to hear. I'm so glad it was a smooth process for both of you. So thank you for sharing a little bit about being an international student and still being able to do this opportunity. That's wonderful. So now I'm going to go ahead and go back to you real quick. Can you tell us a little bit about what is contact tracing and why it's important?
Yeah, so basically contact tracing is like, so contacts are people who were exposed to someone tested positive. So people who are tested positive are called case. and people who are exposed to this case are called contacts. So we as a contact tracers call contacts and then inform them that they were exposed if they don't know, and we ask them if they have any symptoms, and we ask them like we ask them to quarantine at home, and if they had to be tested, we recommend them for testing, and if they don't know where to go for testing, we tell them where to go for testing, and if they have any questions, we just let them know, and they can ask us, and then we can inform them. And also we record, like every time we talk to any contacts, we record everything like their symptoms, whatever we talk to them, and anything. So yeah, basically, I think it's contact tracing is very helpful, especially in this pandemic, to stop the spread, because since this COVID-19 is especially very asymptomatic, and many people don't know that they have it. So it's very nice that it's very good that we inform them, because then they know that they were exposed, so that they can quarantine and stop the spread. Otherwise, like it will keep spreading in the community. And many people whom called, they appreciate very much, because they don't know that they were exposed. And so when we informed them, that they were kind of thankful to us, that thanks for informing me, so that I can quarantine and take preventative measures. So I think contact tracing is very helpful in this, especially to stop the spread of COVID-19.
Thank you. Karabi, Sonam did a great job explaining a little bit about what contact tracing is and why it's important. You were also a contact tracer right there with her. And so from your point of view, why do you think contact tracing is important?
Sonam actually explained very well. And I really feel contact tracing is very important, because this is COVID-19. It is related with asymptomatic patient. It is very hard to find out those asymptomatic patients. So anyone who comes into close contact with someone who has COVID-19 is at increased risk of becoming infected themselves and of potentially infecting others. So contact tracing can help prevent further transmission of the virus by quickly identifying and informing people who may be infected and contagious. And that's how they can take steps to not infect others. And contact tracing begins with identifying everyone that a person recently diagnosed with COVID-19 has been in contact with since they became contagious. This is an important thing also. In the case of COVID-19, a person may be contagious 48 to 72 hours before they started to experience symptoms. I mean, if people follow the contact tracing rules, and if they pick up the phone, it will actually help to stop the spread in the community. In that way, contact tracing is very important.
Thank you. Can you take us through a typical day? What's a day in the life of a contact tracer like, Karabi?
My day is very hectic. I actually work in weekend. So I start from 10 or 11. I start calling people, and it sometimes affect me mentally, because I also feel connected with them. I hear their sorrow. I feel their anxiety. I feel their fear. I love to soothe them. I try to soothe them. I try to understand their point of view. Sometimes they are very much angry and they don't want to give us information. However, I try to be calm. I try to motivate them to give us information. I try to ensure them. And after that, I'm a student, so I need to do my assignments and everything. It has mental impact on us, but I love to help people. At the end of the day, I feel good when I feel that someone who is in need has some information from me. So it's a hectic day for contact tracers, but at the end of the day, you will feel good.
Thank you. Sonam, can you share a little bit about what a typical day looks like for you as a contact tracer?
Sure. Like each day, we are all assigned like who to contact. Like we have a different category in the MTX system. Like sometimes our supervisor will tell us to contact people who are in the monitoring group, like who already enrolled into the program and who are the monitoring group. Or sometimes we have to contact the people who we have to call them for the first time. So it depends what category you are assigned to. And then depending on that, so right now I'm assigned into like people who are already engaged, who are already into our system. And so we just have to call them once in a while to check on them if they have been tested and what the results are, things like that. So my typical day, like, I mean, sometimes it's kind of like you call and no one picks up, and every day my comments will be like, no response, left a voice message and this. And I kind of feel like I didn't do good or something, you know, like because no one picks up, and I just feel like I wasted my time or something. But sometimes like a lot of people pick up the call and I have a very good conversations and people ask questions and people listen and I kind of feel like good about it. And sometimes like people are very appreciative and they are very thankful and they ask us questions. And especially now, like right now, I'm contacting to a lot of people who are like parents of the children. And since the school started in Georgia, a lot of children were exposed in the school. So we are contacting to a lot of children's parents. And so right now we are like kind of like informing parents that now they can go back to school, and if they have if they have tested their child and what was the result. And yeah, so it's kind of like every month or maybe after 3 weeks or something, it kind of changes a little bit. Like in the beginning we were kind of calling people who are elderly kind of, and slowly like it moved to Georgia Southern students who were exposed, and now we are like kind of contacting people who are like the kindergarten, pre-K kindergarten parents. So it's been interesting. It's also interesting to see like, you know, what like the pattern of the transmissions and exposure. So yeah.
Thank both of you. Ladies, y'all did a great job explaining the process and why it's important. And it really sounds like every day is a little different. It's interesting to see the shift in ages that you mentioned, Sonam. So I would love if y'all could share just maybe an interesting experience y'all have had, something unique that has happened. I'll let Karabi, you want to go ahead and start?
Yes, sure. There are lots of interesting story to share, to be honest, but every day is a new story to me. I'd like to tell my favorite one. So I work on weekend. My supervisor informed me about one individual case who is not willing to give the information where she actually worked. The case already got too many calls and was frustrated, and that is very usual. So the team lead requested me to call her again and investigate about her workplace after 2 days because it was Friday, so I need to call her Sunday. I saw in the file that case had lots of contacts and works in a food facility. I felt that it was important to identify her facility to notify others about the potential risk. So what I did, first I tried to get information from other contacts. No one was willing to give the information about her workplace. And normally, I realized that normally students have a tendency to live near their workplace or university. I identified the food facilities around her address. I started asking questions in different way to other contacts. This time I succeeded to narrow it down to 3 or 4 possible facilities. At last, her partner gave the solid confirmation of my suspected facility. We found it out and we informed them. If anyone loves to solve mystery or good at solving puzzle, I think this is a good job for them.
Thank you. You did some very good detective work. Sonam, do you have any interesting or unique stories to share with us?
I don't know, there are like so many unique stories and experiences. But one of the things that I found, like working as a contract tracer now for a few months now, like more than a few months now, like the teamwork that we all are working together, the teamwork is kind of like, I thought it was very, very interesting for me. And like not just teamwork among us contract tracers and this contract tracing team, but among people, like even local communities. Like in the beginning, like when we were contacting people who were exposed in the workplace, so we didn't have contact numbers. Like we only have one person's contact number, and that's a workplace. And there's no way we can get the phone numbers of all these people who work there in one place. And so one experience that I found was very interesting was like we call the human HR department in the company in a Statesboro, and then the HR department like gave a contact number of everyone like whom I mentioned the name. And so it was interesting for me like how like people who know about how contact tracing works and how important it is, like they all kind of work together, like kind of help us to actually do this job, you know. So I thought that was very interesting, because there are also some organizations that were not willing to provide contact numbers of like of their of the employees, which I totally understand. But like, so that's why I like the fact that it's very teamwork, and people who know about it and who knows about it and who knows the importance of it, like kind of work together for us to help actually spread the COVID-19. So I thought that was very interesting. The other interesting stories is like, I can't think of now. I will share later when I think.
No, thank you. You know, it's interesting you talk about the community approach and the team effort, and it really sounds like it does take everyone participating and helping out to make this really a key to prevention of the spread of COVID-19. So thank you for sharing that. Y'all briefly already talked a little bit about the challenges. I've heard that come up a few times in your conversation. So what are some challenges to being a contact tracer? Karabi, you want to start for us?
Should I start? So some of the challenges that I faced are, can you hear me? So some of the challenges that I face are like, as an international student with a strong accent, people think like when we call, people think that we are calling like they are getting calls from somewhere from abroad, because they are getting called from someone like who is not a native speaker. So some people refuse to continue talk to us, and they just hang up. So in the beginning, I kind of felt that a lot. I think it's just because of our accent. They think that they got called from abroad, like random calls. And so that was one challenge in the beginning. And also, I think in the beginning, we are all learning, especially us being international students, we are like learning. This is like so much more new for us, like, you know, like calling people randomly, you know, in the US here. And so it took us a while to actually adjust and learn as we go. So I think maybe our confidence as well, as we like inform people and like answer their questions, and because we all are learning, and these things is so new, this virus, and we don't have answers for everything, you know, when people ask us. And also we didn't have like 100% confidence to like to reply all their answers. So maybe that also like kind of push people a little back when we call them as a non-native speaker. But I think eventually what I learned is like, eventually, like as we continue with this work, and when we had like higher confidence, and also like when we like, I think we have to be more confident when we talk to people, and then people listen to you, and then they kind of believe that you are valid, you know, this is the valid and it's not fake call or anything. And so once I also had a conversation with a couple, elderly couple, who said that, oh, we thought you were calling from India, you know. And then I had to say that, no, I'm international students here. I have to introduce myself. I'm an international students here studying in Georgia Southern and all this. And then I was like, yeah, I'm working as this. And I have to, some people didn't know what contract tracing is in the beginning. So we had to like, I had to go extra miles to explain them and all this, because otherwise people will not trust to any other calls who will call them again in the future. And so, yeah, so these were some of the challenges, but I think eventually, like, I think it was kind of perfect. Right now, I feel so comfortable, and yeah, people listen to us, and sometimes people even talk to us like this. You're not from here. Where are you from? You know, some of the ask, and then someone I also like actually talked to him. That person was not from here, but working, and they kind of started sharing their experience of not being an American, and so it was kind of interesting as well. But I kind of enjoyed the process.
Wow, thank you for sharing. I can really see, you know, just over time, your confidence has changed, and certainly a challenge, but you definitely overcame that. Karabi, what about you? What were some specific challenges you faced?
My challenge is bit similar like Sonam. I'm originally from Bangladesh, and it's been only 1 year I'm here. Starting a new life 1,000 miles away from my home and family is very challenging to me. All of a sudden that pandemic happened and I was literally broken into pieces. I started this job and it was a big challenge for me to connect with community because of that language, because of that heavy accent. And it actually sometimes hindered the interview process because they're telling me, I can't understand you. However, I keep my patience and calm to overcome the challenge. I learned a lot from the whole process. I learned a lot from community. How Sonam described that they started to talk with us, they started to open up with us. That's the good part, or that's the interesting part of that job. Initially, no one wanted to cooperate. I clearly feel that their fear, anxiety, and uncertainty people are going through. I feel connected with all of the affected family because I am affected in a way. I'm far away from my home, and I realize that we all are passing a difficult time. It is not only me who is going through a strange and unprecedented time. We need to pass this time all together, which communities fail to work as a society rather than individual will face tremendous challenge and also facing tremendous challenges. So I really felt like this is a time to help each other. This is a time to be patient, being safe and keep others safe. And I face lots of challenges, but I love to take challenges and I overcome it. Now I'm very comfortable with my job, and sometimes I talk with contacts. They talk with me. They love to talk with me. So yes, there were lots of challenges. End of the day, we are doing the job very well.
Well, I'm encouraged by both of y'all because I think everyone on this call was thrown into a pandemic, like you said, and y'all really just stood. You stepped up, and what you're doing with the Department of Public Health is so valuable. So, thank y'all for that. Let's transition over because y'all are also students. You are busy with assignments. Or you just finished up with that. So can you tell us a little bit about how your program of study prepared you for this opportunity? Were there any specific classes you found beneficial?
The success of that case investigation and contact tracing program actually depends on a community level of participation. For many community members, this may be the first time they have engaged with public health personnel. Contact tracing need understanding of community and how we can engage with community. So my major is community health behavior and education, which helps me to achieve the competencies I need to work as a contact tracer, such as community engagement, cultural competency, ethical perspective. We learned ethical perspective in last summer, and that also helped me to understand that confidentiality, HIPAA Act, and there are lots of, when we work for public health, we need to understand that every situation is different. Every situation is unique. So in that every situation, how we can work, how we can achieve the goal, that actually I learned from community health. So it is very related to my study.
Thank you. Sonam, how does your program of study help prepare you for this opportunity? Sonam, can you hear us? I think we might have frozen again. we'll have her leave and rejoin us. That seems to fix the problem. Oh, yay, there you are. Sonam, welcome back. Let me repeat the question. How has your program of study helped prepare you for this opportunity?
Sorry, my screen keeps going on and off. I don't know why. It's just disappearing. It comes back itself. Okay, yeah. So for me, I think as I was doing this, I think one of the things that program really taught me was cultural competency. Even though we don't directly meet people and we don't know what cultural background they are coming from, but by talking to them in the phone, we are talking to a diverse group of people, like in terms of education, age, race, like whatnot, you know. So I think having trained of that cultural competence is so important, especially in a job that like when I was taking some courses, we are always like taught to actually know the barriers that people are going through, because just forcing them to do, okay, you have to do this is the right thing, it doesn't work, because we have to know the what the obstacles are, what barriers they are having to that's preventing them to do the thing that they want to do. So knowing the barriers is very important as well, because when I was doing contract tracings, like we recommend them for testing if they are showing symptoms, but some people don't know where to go for testing. They don't know where it is, but they don't know whether it's free or not. And for some people it's a financial issue. They, even though they want to go for testing, but because they think they can't afford for it, so they don't go for testing. So we as a contract tracers like kind of inform them that the system, the lab that are organized by the health departments are free and they can go and things like that. Because for many people, like, it's the cost that's the issue. So we have to know their barriers. And also, like, I think for some people they want to go testing, but then there's like, for some people who is a caregiver, like who has an elderly mother at home, and they can't go out because there's no one to replace to take care of the elderly at home. So like there are a lot of barriers. And also we ask people to quarantine at home, like, you know, and we ask them like, when were you last exposed? If the husband was the one who was tested positive, the whole family, we have to contact the whole family, the child, the mother, everyone. And so we ask them to quarantine them or isolate them, like, but if they're in the family, it's hard for some people. They cannot quarantine, they don't have extra rooms or anything, you know. So sometimes I think it's very important to know their situations, maybe get to know them better before we kind of inform them and say anything. So I think these are very important things, instead of us just like pushing them the informations. Like, I think getting to know them better first, and then being empathetic, and then based on that we suggest or recommend them. I think that's something that I actually learned in school and that I implement now. And also HIPAA, like we have learned about HIPAA a lot, and we also had a training about this. And so that has also really like I really take that very seriously as well, especially like when we call contacts. Like in the beginning, they kind of ask us like, who told me I was exposed to, who I was exposed to. They don't know, you know, and we know who they were exposed to, but we cannot reveal the name because of HIPAA. And some people are like very persistent and very like, you know, they really want to know who they were exposed, and we cannot tell unless like they hesitate to talk to us, then we reveal it, but otherwise we don't. So things like that, I kind of like, I think through the programs at Georgia Southern, like I kind of learned all this well, and it's helping me in my job right now.
Thank you both for sharing how you've been able to apply some of the competencies into practice. That's great. Let's talk a little bit about what opportunities that this experience has opened up. And when I think opportunities, feel free to discuss some of your research interests or research projects, some of the skills you learned or networking. So Karabi, why don't you take a minute and just share a little bit about some of your future research, future career goals from this opportunity?
I want to implement my practicum experience of being part of that contact tracing team into infectious disease research, specifically the recent coronavirus pandemic and the further investigation of developing new policies that will aid, understand, and substantial preparation for a future pandemic. Pandemic like COVID-19 are set to become part of our new normal. We have to learn how to respond to future outbreaks effectively and with the least economic damage. We all know that this pandemic actually damaged our economy very badly. So active strategies and well-resourced healthcare organization should be the key factor for any future pandemic response. I want to work on the future pandemic response strategy and work with local and international organizations.
Very exciting. So now tell us a little bit about some of your future goals and what opportunities this experience has opened up for you.
Through this experience, I really my communication skills has like improved so much through this experience, because it's like all communication basically, whether you're talking to your supervisor or whether you're talking to your colleagues or to the community, it's all talking, you know, communication. So really, it really helped me with my communication. And I mean, in the future, I want to like kind of conduct like health interventions in rural areas in Nepal. So communication is a key, and it's a great skill for public health. So this really helped me a lot. But in terms of, I mean, in the future, I plan to work in the health department. I don't know if in Georgia or any states in general. And with this experience and working here, it will really help me to, I think, get a better opportunities in the future as well.
Thank you for sharing. We're going to go ahead and we will start opening it up for questions right now. So feel free to use the chat box to ask your question, or you are able to unmute yourself and ask if you would like. Let's see if we get any. Who's going to be the first?
So, Ms. Cromley, I have a question. I'll start off with this.
Okay, great. Thanks. I was going to be okay with some silence for a minute. So thank you, Dr. Telfair, for speaking up.
That's okay. Well, Dr. Smallwood does as well. My question to both of the young ladies, so given that you all spoke a lot about the challenges and rewards and learning of being an international student, and I'm just wondering, given the settings that you have worked in for the contact tracings, how similar or different would these settings be? If you were doing this in your country of origin, what would you do? Would you do the same or different? Would it, in terms of the experience and in terms of how the operations work?
I think in my country, I'm not going to do the contact tracing in that way, because contact tracing is very related with culture and the community. First, we need to understand the community. And if we don't understand the community, the contact tracing will not work. Right now in USA, contact tracing is a very good way to stop the spread, but it's not working in USA how it should work, because the community is very different. The people's mindset is very different. They are not ready to abide by with contact tracers recommendation guidelines. But in USA also, some population, some community take it very seriously, and their cases decreased because of contact tracing. So if I want to do that same contact tracing in my country, first I will try to understand my community. I will design the contact tracing process by that way. I will try to communicate with in that way. I will tell everyone in a different way. Even here, when I speak to people every day, for everyone, I took different strategy. If someone is very angry, I was trying to be submissive in a way. And if someone is very scared, I was trying to be authoritative. So it's different for every people. And in the same way, it's different for every country.
I think in Nepal, I think contact tracing will not work. I feel like it because first of all, it's a different cultural, different setting. I mean, not many people have like phones, and not many people have been to school. So it's like it'll be like a lot of explaining in the phone, like a lot of explanations, and yeah, and people will not follow rules, and people will like, I think it will just be like a waste of time, but I think it will also help, but I think it will take a while to get used to it and to really be effective contract tracing, because people will not easily follow. Like I think even here in the US, like I have talked to some people, some contacts who said like, I don't care, like whether if I go out or not, whether if I have to get it, I will get it. Like people are very resistant, and there are many people like this in Nepal. Like people don't follow what the experts are saying. People don't. They don't follow because they don't know, and they don't know that it will work. So it's a very different cultural mindset and setting in so many ways. So it will be hard to do a contract tracing. I think you want to educate people through like broadcasting, but I think contract tracing it will be difficult, I think.
Great question, Dr. Telfair. We've got a few in the chat box, so I'm going to move over to Dr. Smallwood's question first. He asked, based on your experiences, what recommendations would you offer for improving contact tracing in the future?
So me, Jill, and Sonam were the first contact tracer in Southeast Health Department. That time we didn't have lots of resources. We changed a lot. The MTX system changed a lot. The guidelines changed a lot. Everything changed a lot. And I'm sure that right now whom they are hiring, they are having more opportunities than us. But for improvement in future, I think the contact tracing team should be better prepared. They need to learn more about interviews. They need to have more mock interviews. They need to understand how to be empathetic. They need to understand what they should do for not compliant people, or the person who is in between the grief. Sometimes people are infected and their family members are infected. They are all sick. So in that process, it's just not an interview. I can't just call and tell them you need to follow that guideline. So I really think for contact tracer in that sector, we can work. We can make them better prepared. That's my opinion.
Thank you. Sonam, I'm going to tack on that question right below Dr. Smallwood's to your response too, because we have someone asking how to improve contact tracing in the future. And then we have, are there any areas that you feel are inefficient? So those we can put those two together.
Okay, so what recommendations would you offer for improving contact tracing in the future? So I would say hiring a contract, like the number of contract tracers that are hired. I think in the beginning it was only like a small group of people that were hired. I don't know how many were hired. I think they hired a bunch of students from Georgia Southern, Georgia Tech, Emory, and all this, but I think it wasn't enough at that time as well. And I think they hired more and more eventually. But I think it's very important to hire a lot in the beginning and train them, because while we are like, when I was doing contract tracing, what some people were saying is like they were exposed, like according to them, they said they were exposed like 2 weeks ago, and now we are just calling them, like informing them that they were exposed. And yeah, and so it's all delayed, because we have not enough people to contact them right away, like maybe not today right away, but at least after a few days, like we don't have enough contract tracers to contact these people right away. And so some of them are like kind of angry that we are informing them late. And some of them, we don't have a correct phone number, so we reach them very late, like maybe like 2 days before their monitoring period ends, their quarantine period ends. So yeah, so this morning I talked to somebody, and she said, no one informed her. Quarantining ends today, basically her last day of her 2 weeks ends today, and I was telling her today is the last day, and I was just checking on her, like if she has any symptoms, things like that, and she was kind of like, no one told me I was exposed, you know. And so I think it's very important to like hire a lot of contractors from the beginning, train them, and then like at least, because it takes a time for some from a case investigator to interview the interview the someone tests positive, and then from it takes a while to get into the system. It takes a while for us to get to call them, you know. So it all takes time. So and by that time, some people might have already been in this community spread already spread. So I think it's very important to have a lot of contact tracers. And also, like what I also realized in the beginning, at least, that when this pandemic was just starting, a lot of people were not they didn't know what's contact tracing, and so they didn't know who we are and what is it, and you know, they have no clue, like at least a lot of people. And I kind of understand as well, because I don't know, I mean, the Georgia governor kind of mentioned about it, but still not many people know about it. So in the beginning I had to really educate them, like instead of me asking their symptoms, I had to tell them who I am and what we are trying to do and everything before they started trusting us, you know. So it took, like in the beginning I had to in 10 15 minutes I always have to tell what is contact tracing, basically, so inform, like to let people know that what it is. So that's why it's also important to let public in general know that this is going on and this is what it is, you know. And one other thing that I would recommend is also like because a lot of people, we say, okay, you were exposed and you have to quarantine at home for 2 weeks. And for some people, they cannot just stay home and they just leave job and stay home, you know. And some people ask us, like, can I get a letter or something saying that I have to be quarantined, so that like, you know, I have to, so that I can show it to my boss that I can stay home. And when I ask that to my supervisor about it, they don't issue any letter or anything. And it's kind of like, I see there's a gap, like, you know, we just don't tell, I don't know, we tell people communities to, like, we tell people in the communities to quarantine, but then we don't help them, like kind of accommodate them or something to do what they're supposed to do. And I don't know, I kind of felt like there's a gap that we can kind of fix it. I don't know. But I think at towards the end, we kind of started issuing some letter or something saying that they have to quarantine because they were exposed and things like that. But in the beginning, we were not issuing any letter or anything to show it to their boss that they were exposed.
Wow, very great insight from the two of you. Thank you. We have Mr. Charles Owens asked a question. So graduation, yay, getting close. How has this experience influenced after graduation or your career goals?
So I shifted 100-degree after that job. Before that, my interest was on tobacco smoking, but now I'm really interested in pandemic research. Now I'm really interested in COVID-19, and so yes, for me, that job has a very big impact on my career goal. I want to join with maybe national or international organizations to work for future pandemic plan. We need to do lots of research on this pandemic also. We need to learn what we did mistake. We don't need to do that mistake again. And for this reason, I really feel it's a very good sector to do research, and we need lots of researcher, and I'm planning to go in that direction. So this job is really gem to me, and I'm really thankful to everyone who bring that opportunity for me.
Thank you, Karabi. That's very exciting. Thank you for sharing. So now, what about for you? Tell us a little bit about your career goals.
I don't have specific career goals for now. I also plan to work in a nonprofit organizations internationally if possible. But first of all, I want to start working in a nonprofit organization here in US that actually works on like maternal health, reproductive health, and things like that. Completely different from COVID. So yeah, but this working on this COVID-19 has really it really gave me a good understanding of how the system works here in US. like the teamwork. We always, in public health, we always say like, oh, you work in a team later in the real world, but it is actually working as a team. Like, you know, I was just fascinated how nicely the team was working together, you know. And it hasn't changed my plans for education or anything, but I think it has changed me to actually go for research in the future, like do some research. Yeah.
Thank you. Let's move on. We have Randall Ford has asked a question. Well, maybe two. Let's see. Let's go with the first one. Sonam mentioned that some people didn't seem to care if they got COVID or not. Did you notice any trends in groups that held different ideas as to COVID?
Okay. I think I don't know. I mean, I cannot tell. Like groups. I think some people are like in their mid-30s. Yeah, mid-30s. Uh, like they were didn't care much about community or themselves. And I also somebody that I spoke also said like, I'm Republican. I will not get COVID. And so yeah, like. I mean, it's hard for me to tell that exact groups of people because I can see, I think age-wise, I think it's around like mid or late 30s. I think the younger people that I contacted were from Georgia Southern and few from Georgia Tech. I mean, they were all like, they were listening and they were doing their part, everything. But there were a few people I think who were in their late 30s, yeah, early 40s. I think around that age, I would say.
Karabi, did you notice anything in your experience as far as trends in certain groups?
Thanks, Randall, for your question. So Sonam actually talked about people didn't seem to care. I am not going to talk about who is not willing to care, but some people are afraid, like immigrant group of people, the people who can't speak well, and it's not their first language, English is not their first language. They are the most afraid group of people who was really afraid that what we are going to do with them is that going to affect them. So they didn't want to abide by the guideline and they didn't want to be in the home. So my solution is I understand their feelings also because they are in a different country and immigration process is a very different process. So every immigrants know that if it's for an American person, if it's one paperwork, for us, it's 10 paperworks. So sometimes people are scared to tell that I have COVID. People are scared to tell their employees that I have COVID, I need to be in quarantine, which is not good for community. We need to figure out something to make them comfortable, to assure them that nothing will happen. And we have interpreter for them because we understand, sometimes they don't understand English. We have interpreter list. We try our best, but I really think we can do more. We need to think more about that vulnerable group. And elder people, they are also vulnerable group, but they want to abide by the guideline. They're okay with the guideline. Young people have two different things. Like when I contacted with Georgia Southern population, some of them are really good because they are educated. They understand the guideline easier. They understand the guideline properly than other groups. But some of the young people have the tendency to think that I am not in risk and I don't need to do it for community. So for young people, it's 50-50. In my experience. Yes, that's what I actually experienced in my job.
Thank you. I think y'all both have a different viewpoint than someone who has not done contact tracing. So we appreciate you sharing that. We have about 4 minutes left. There's a pretty big question that Randall asked next. I would be interested to see if y'all have any insight into this. He said, I have one employee that has had to quarantine twice. She has been out for a month. This is very hard on small businesses. Do you have any insight on how this conundrum can be resolved? So a real problem. So I'm interested, do y'all have any insight into that?
Thank you, Randall, again for your wonderful question. And that's the question came to my mind also. When I called a person and tell them stay at home for 14 days and he or she has a small business, it is not easy. We need to earn. For me, I need to do my job because I need to earn. I felt that we have lots of guidelines for small businesses. We have guidelines for restaurants. We have guidelines for healthcare professionals. So we need to maintain that guideline properly. We need to try to maintain that guideline. And for workers, I understand it is hard to give them, if they are not in the workplace for twice, this is hard, but this is important also. Because if they are infected all the other people, then they need to shut down. So it's better to give her some time to not, some time to be, get well soon. But yes, that question is very tricky and very, hard question for me. I'm not an economist, so it's very hard for me to answer properly.
Yeah, I think same with me. I mean, I don't have one solid answer for this, but I think when they are first exposed, they should be quarantined for 2 weeks at home. And after that, I think if you have a lot of employees in your business, then I think the good way is like if it's possible, maybe work remotely, or otherwise have all the social distancing procedures in place at workplace. I think that's the only way we can kind of resolve that kind of issues. But I don't have any other solid.
Yes, very, very tough question, Randall, and I don't know if there's a right answer, but y'all did a great job with that.
Jamie, can I add a little bit to that?
You have about 30 seconds you can add to it before we turn it over to Dr. Telfair. Yes.
What I was going to say is, as far as the employee getting paid, the Paycheck Protection Program has allowed us to continue to pay them. But when we've only got 5 or 6 employees in the entire office, the hard part is finding a way to replace their work. And some of it can be done remotely, as Sonam suggested, but some can't. And that's my conundrum. Is that, do I hire somebody just for a couple of weeks? That's really not practical either. So it's being small, it's a lot harder than if you were a large company.
I definitely agree. I think there's so many challenges with that, and I don't have answers either, but yes, good question. Thank you. Well, we have run out of time today, so I'm going to wrap it up and just thank these 2 ladies for sharing their experience with us, working on the front lines in the midst of a pandemic. They have overcome challenges, and I know that we are very proud to have you as 2 of our students in the Jiann-Ping College of Public Health. So I'm going to turn it over back to Dr. Telfair right now to wrap us up.
Hey, thanks everyone, and I'll be very brief. Thank you all. Please pay attention if you can, or rejoin us for our continuing seminar series. We have a number of those coming up for Public Health in Action. I again want to thank both our moderator as well as our 2 panelists. And if you have any questions or any comments or any suggestions, and for future seminars, please let us know. Thank you for your time, and I hope you all have a good rest of the week. And we'll have that. With that, we'll leave. Thank you so much.
Thank you very much.
Okay. Bye-bye.
Thank you.
Okay.